Hello, everyone. I'm Zoe Pressey, and today I'll be presenting mood disorders. The overall abstract of my presentation is that there are various disorders associated with the mood swings, emotion, physical, psychological, physiological, and mental issues that all exist in the majority of human and animal populations, which could oftentimes lead to catastrophic behaviors that spread significantly in these symptoms and conditions that are, if they are not treated or handled properly. Reasonable insights based on who, when, where, or what, and how these moods brings disadvantages for disabled people are very known, but not easily understood. And they are oftentimes misinterpreted because they cannot be diagnosed or tested. Some of their lab results remain unknown, and sometimes doctors just say they can't find anything that's wrong with that person because nothing shows up in their results, when really the person is saying something different because they feel like something's not working right, like something is out of place. Overall, mood swings consist of multiple low, moderate to severe levels of emotional stress, which is triggered from certain traumatic events or intrusive thinking. Many veterans, military soldiers, aircraft pilots, or anyone who works as police officers, medics, surgeon, firemen, or Secret Service has a significantly higher chances of being moody. Intensive workplaces such as laboring workforces or other physical working environments negatively impacts people's decisions and actions throughout negative changes in their environments and in their life. People are not really used to change, and the more comfortable they are to them, the more they adjust to them. And they can do that by being more free, by being exposed to the outside of the world rather than just staying inside, being concealed and isolated from everyone else. They need to be out there more often, and they need to push out their comfort zone in order to adjust to things. These individuals, they struggle throughout their daily and nightly hardships, and they may feel less motivated to push through and less energized. Their loved ones or professionals needs to monitor and record their mental well-being every day, every night, just to make sure that they're getting enough sleep, they are meeting up with the right qualities of how to take care of themselves and how to feel more balanced emotional wise. Conditions and symptoms such as trouble recalling where they are, their surroundings, where they've been, and what they've done yesterday. And in most severe cases, they're they have trouble recalling their name. Irregular sleeping routines, sleep disturbances, and insomnia are also present within their sleeping patterns at night. Hyperfunctioning, racing thoughts, high blood pressure, increased heart rate, and rapid breathing and speech could also be presented in hypermaniac activity, is where someone feels really hyper energized and overly enthusiastic. They are very happy and they are very, very excessively thinking about things, and they just want to do so much in so little time, which can be very overwhelming and very hard on their heart and on their brain. And they really need to be more mindful of how they are treating their body and listen to the feelings that their body tells them. Extreme anxiety could be depressive and make someone feel severe sadness, dread, sympathy, and lack of energy, meaning that they don't have any motivation to keep going and they easily give up and they easily feel sad and they put all the blame on themselves and they feel like everything's their fault when really it's not. Irritation, agitation, aggression, anger, frustration, outbursts can also exist within one's feelings. Feeling a disconnected or detachment from relationships or connections with loved ones and even friendships are really hard for people to get through when it comes to trying to get along with others. They just can't really seem to get along and they can't really seem to understand how other people can relate to them. Treatments and solutions would be to talk to a doctor or a mental health professional. Psychotherapy, cognitive behavior therapy, and electroconvulsive therapy are also things that could help treat these depressions and these hyperactivities. Antidepressants, anticonvulsants, antipsychotics, and medication management all together work on influencing people's decisions, and they serve healthy, positive beneficials to people. The only problem is when people are addicted to medications, they should never be on them. Instead, they should do the talk therapy sessions instead, something that is more suitable for them, that really supports their needs. Repetitive transcranial magnetic stimulation also helps them treat their anxieties and their depressions. Ketamine infusion helps too. Lithium drugs also helps balance out their levels of emotions, and beta blockers prevents their emotions and their feelings and their dysregulated balances to from getting any worse throughout time, and they balance them out. In conclusion, people who suffer from mood swings should be carefully monitored 24/7 by their close ones or specialists. Correcting their sleep patterns and making adjustments to their schedule would really allow them to get the required 7 to 8 hours of sleep that they really need on a nightly basis, and to help them organize their routines and get enthusiastic and more involved in social interaction, and be more involved in activities and be willing to do them. And stay off of medications that are addicting to them. And therapeutic talks encourages these people to progressively stay out of the negative behaviors, reshapes their interpretations of how they view things and emotionally feel. These techniques reduces these side effects and allows the person to gain more control over themselves throughout time. Statistically, the chart from 2014 to 2025 skewed right from 2025 to 2022, which skewed left. But the most significant change in the increase of how well each treatment did was in the year of 2025. These illustrations and visuals help people picture what it would be like for other people that suffer throughout these symptoms and conditions. For example, the first picture of the lady that has all these different moods around her is how she really feels on a daily and nightly basis. And these thoughts and these excessive things don't seem to stop. They keep repeating over and over again, and they drive people insane. The bottom picture is how people can really relate to their moods due to the weather. For example, if it's really rainy or thundering and lightning outside, people feel a bit gloomier because they're not getting the right vitamins that they need from the sun, and they just feel like they are low on energy compared to a very sunny and beautiful day. And the rainbow represents the happiness that they may be feeling too, because when you look at a rainbow when it's very clear outside, they may think it's very beautiful and they really like the colors in it too, and that may make them feel a bit happier and brighten up their day. To the left, there's a whole bunch of disabilities that they may be suffering from, these kinds of disorders and these kinds of things that they feel emotionally. That's what that picture represents. And here's statistics and graphs. So in the year 2022, they reported that mood stabilizers, anticonvulsants, anti-anxiety drugs, antipsychotic drugs, and antidepressant drugs worked the best for people compared to the other years that fall below the level of how they work. For example, in 2022, the most effective, the most better working medicines and treatments were developed by then, because people have reported that they have significant feelings and more positive changes to their moods and behaviors, and that they are feeling much more balanced than people who report that they have been feeling more depressed or more anxious or more moodier, and they reported that the treatments do not work as efficiently for them in the previous years before that year. And that concludes the end of my slide. I hope you all enjoyed it, and I'm looking forward to spending the rest of the semester with you all. Bye.